Hello, I'm Dr. Jar, Director of Renewed Skin and Health Clinic, and today I have opportunity to meet Mr. Cooper, Mr. Andrew Cooper, who is a hair consultant and has been in the hair industry for over 10 years. Hello, Mr. Cooper, how are you doing?
Very well, how are you?
Yes, you have been in the hair industry for over 10 years now, and what services are available for those people who are struggling with the hair loss?
Well, we offer services both of a non-surgical and surgical solution for both male and female hair loss sufferers. So depending on the severity of hair loss, we offer quite a unique package to everybody, personally catered to their individual needs.
Sure. Excellent. And tell me a little bit about the surgical route.
Well, there are two types of surgery which are out in the marketplace at the moment. One is called FUT, follicular unit transplant. It's probably the most popular and most well known because it's been around the longest, and that's alternatively called strip method, strip harvest technique, where a strip is taken from the back of the head and the individual follicular units are then dissected and re-implanted into the recipient area. The latest evolution in hair transplant, made famous by the likes of Wayne Rooney, is called FUE, follicular unit extraction. And that technique actually extracts each and every individual hair one by one, alleviating the linear scar that's most commonly caused by an FUT procedure.
So many people don't like a big scar at the back of their head.
No, depending on the way they style their hair and the way they want to style their hair in the coming years will dictate which treatment is best for them. But what's important to be aware of is obviously the recipient need. How much hair do they need? Because not everybody is suitable for an FUE procedure.
Sure. And are these solutions permanent?
Hair restoration is a permanent solution for the pure and simple reason that we have donor hair at the back and the sides of the head which is immune from the effects of the DHT, and as such we can then extract this hair, re-implant it into the recipient area, and it will remain there for the rest of your living days.
Excellent. And going back to the FUE and FUT, can you tell me a little bit more about the previously done method, which is the strip method?
Certainly. Well, FUT was originally invented many years ago, and people may have a preconceived idea that the hairs can look a little pluggy. That's because in the early 80s and probably the late 70s, the hair was put in a larger element, as opposed to now when it's individually dissected into every individual follicular unit, one by one, which allows it to be a lot softer and a lot more natural in appearance.
So the hairlines are more natural?
Much softer, much more natural.
Right, it doesn't look anything artificial?
Not at all. Each hair is put in individually at the right angle with the hairs overlapping, so it's as natural as we can possibly make it.
Good. And what about the strip method, the previously done strip method? Tell me about the procedure. Is it done on local anesthetic?
We perform the surgery as a day case under local anaesthetic. The patient would obviously enter into the theatre. We would anaesthetise the back of the scalp. There'd be a wake throughout. We would remove a small strip of skin from the back of the head and then suture up that incision and make the incisions where the hair implants are going to be placed. During which time the hair technicians, a team of advanced trained technicians, will dissect each and every follicular unit into their individual states, and then we return after feeding the patient, because a hair transplant isn't a quick thing. We do have hold of that patient for the entire day, and then we re-implant. Normally at around lunchtime we start the re-implantation process, so by 5-6 o'clock a patient can leave with, in essence, a full head of hair.
In somebody who has got a very large area of hair loss, and you, after consultation, you tell him that, okay, I think you'll be best suitable for the strip method because you have to cover a large area of the scalp. In that case, the procedure can last the whole day, 9 a.m. till late in the evening?
The procedure would normally last around 7 to 8 hours. With an FUT procedure, because we have the flexibility of having a larger team of surgical staff in order to assist the surgeon during the theatre, the technicians are the people that dissect each and every follicular unit. So for a larger procedure we would have more technicians, hence eliminating some of the time needed for such a procedure. FUE is the procedure where we can't have large teams for the pure and simple reason that we can't all work on one individual's head at the same time. So an FUE procedure is limited to say 1,500 grafts per day, whereas an FUT procedure, based on the space we have in a theatre, we could do up to 3,500 follicular units.
And depending upon the type of hair loss, would you advise a combination of the treatment of the two?
It is often the case that a patient may come in with a preconceived idea that they would desire an FUE procedure, but then at consultation we determine that they may not be suitable and that may not be the best path for them to take. Alternatively, they may try an FUT procedure initially to get the majority of their hair transplant done, and then have a small FUE, say 6 or 12 months later, to top up the area because they don't want an additional linear scar. So a combination is easily possible, yes.
Fantastic, fantastic. And what sort of waiting time the patients?
Well, as a hair transplant provider, we're relatively busy, and with the amount of people that are actively coming forward, celebrities and such like, having hair transplants, it means that we're looking for a waiting time of between 3 and 4 weeks for a surgical solution.
Very good. And is there finance available?
We do actually have finance in place. We offer both interest-free finance spread over 12 months, or alternatively you can take a more traditional approach and spread the cost over 2 to 5 years.
Very good, thank
you. Make it very affordable.
Thank you.
Thank you.